Oh, welcome to another episode of the Growth Compass. Shout out to our sponsor, Senders. If you want to do email deliverability, it's in the description somewhere below our faces. Without them, it would not be possible to interview awesome people doing awesome things like Bo. Welcome.
Thank you, Blake. Thanks for having me.
Yeah, this is um, like I was saying before. I think health, tech, healthcare, anything having to do with that area is it's really important work that you're doing. It is one of the hardest things you could choose to do, on top of one of the hardest things you could choose to do in the first place, which is start a company. So I'm always excited to have these conversations and excited to get into your experience with Youlify. But for anyone that doesn't know yet, if you could just give a brief introduction of yourself and what you're
Yeah,
building.
yeah, and yeah, Blake. Once again, thank you for having me, and thank you for the kind compliments. But yeah,
Yeah.
it's I would say the founder journey is always a tough one, and I think it's the most meaningful when it comes from your own kind of frustrations and kind of journey through life and professional career. And my background is I'm a former cardiothoracic surgeon, so heart and lung surgery as well as emergency physician. Um, was formerly a physician executive and kind of was the chair of my department, meaning that kind of just the leader, um, helping us kind of get through the clinical operations and the financial operations, namely medical billing, to make sure we get paid adequately and fairly, both before and during the pandemic. So very challenging times for physicians in general during that, I would say, couple of years.
And is that what gave rise to uh, Youlify? I like how long have you been
Yeah,
working on
yeah,
that?
yeah. And so yes, definitely. And so that's kind of the source of where that pain and journey came from. I think that going through that, obviously, I'm sure it stirs up a little bit of PTSD for a lot of physicians. Taking care of critically ill patients, and I think at a time where we were put on a pedestal as, kind of heroes, people didn't realize that, a lot of the administrative financial burden on us, which were, making sure we got paid for the service and care that we provided to patients, was a struggle. And a lot of people were burnt out during that experience. A lot of the older physicians actually quit medicine altogether. So I had the unfortunate task of making sure that we got reimbursed from all the insurance payers and making sure that we can distribute that money back to physicians, and also planning for the future. And cash flow was a big word that kind of popped in my head and discussed frequently with my colleagues as well as kind of the executive team in the hospital, because you always want to have stability projecting forward. And that is one thing that physicians always look for because they go into this field thinking that it's a financially stable field. But it's a little deceiving, to say the least.
So, so okay. I really want to continue going down that path because I think you introduced it so well, but I think it's important. I think it's important that we get some context into
Yeah.
what you're doing beforehand. And so, is this your first? I mean, is this your first company? And if it is, and is it your first experience with entrepreneurship? Let's start there.
Yeah. Yeah. I would say from, you know, uh, a real full-hearted effort, this would be my first company. Although I would say from an entrepreneurial standpoint, I did work on some other ideas in terms of early AI with computer vision for surgical instruments, and had some early success with that. But in terms of like giving up my clinical career, in terms of like putting 100% of my eggs in this one basket to really tackle what I believe is the biggest challenge, not only in healthcare of my time, of our time, where medicine, healthcare is really the backbone of society, yes, this is my first company.
So, okay, cool. Because if you've done multiple of those, I mean, that would be like,
Yeah.
mind blowing. But so then, like, just a little bit about your experience as a physician. Then, so, to my understanding, it started out being mainly the service that you speak to, as far as, and if I understand the name correctly, you're doing the heart surgeries mostly, or
Yeah,
diagnosis, things like that.
previously I did heart surgery and lung surgery, and currently as an emergency physician. Yeah.
Okay.
So,
And so how many years roughly would you say you were
yeah.
specifically doing that before you moved
Yeah.
into the management aspect?
Yeah, yeah. So, in any kind of medical journey, the standard way is, we have 4 years of college, and so actually a more prevalent thing over the past, I would say, decade, a few years of work, clinical research, or some type of real life experience before you kind of go into medical school. And then you have 4 years of medical school, and then you have what is called residency, which is the training portion of that. So I transition from emergency medicine and training to, from cardiothoracic surgery to emergency medicine. So had the privilege of of doing two specialty trainings, which is actually kind of like two ends of the spectrum, but different forms of adrenaline and
Okay.
excitement. But at the end of the day, it comes down to one crucial philosophy, which is taking care of patients. And was serendipitously led to the administrative side, wanting to see what's behind closed doors and why a lot of decisions were made without our voice in that equation.
So what was the thought process at the time when you were making that transition?
Yeah,
And what was your initial experience? Why was it that something about it spoke to you? A little bit.
yeah. To the administrative side or to the
Yeah.
entrepreneurial side. Yeah,
No, yeah. When you
yeah,
transitioned
yeah,
from the surgery into the admin side of things, what
yeah,
about that spoke to you?
yeah. I would say, it's a little bit of combination of luck, of a combination of starting to understand that really, as much as I love taking care of patients, and that's always fundamentally key to me, it's really, I realize, non-clinicians holding the keys, um, controlling the flow of money that gets watered down to physicians dictating how we should practice, how we should document, and
Mm.
sometimes affecting patient outcome, life or death situations sometimes. And the faster I realized that, the faster I realized I needed to learn more. I realized I needed to do my due diligence. I realized that if I want to have a bigger impact, uh, systematically and to have methodically breakdown of why we lost our voice in healthcare, I needed to understand the financial component of that.
Have you always had the drive, the curiosity to understand things like on such a huge level? Because like I'm fortunate enough, I have a decent amount of friends, I would say, that are, I mean, at this point, like in residency and have gone to med school and stuff like that.
Yeah,
And some of them do it for this aspect of like, why I really want to help people type of thing.
yeah,
And then some of them are just like, I'm fascinated by the science, and they don't have time really. I mean, it's easy to not have time when you're trying to do all this stuff to think about anything else. So like,
yeah,
have you always thought about these things, or were these kind of novel to you
yeah, yeah.
at that time?
Yeah, I wouldn't say it's novel, but I have always been curious about the non-clinical side um, of healthcare. And I would say I'm just very, very naturally curious about everything. And sometimes
Hmm.
that that is not that is frowned upon in healthcare or in medicine, I would say. And medicine is a hierarchical experience of just do as you're told. Sometimes you have kind of blinders and you have that tunnel vision. And we're physicians and healthcare, we're not really receptive to change, unfortunately, because we're just so focused on that next step. And sometimes you have to take a step back and look at the roadmap of what our field is developing into. So, one not to digress here, but like one aspect that made me change from cardiothoracic surgery is realizing we were a very slow moving field. We lost a big chunk of our field to interventional cardiologists because we just weren't quick to embrace change and to adopt new techniques, new instrumentations, a new way of taking care of heart disease. And I realized that innovation and change does not wait for anything or anyone. And either you adapt to it quickly, or you perish.
I guess, yeah. So okay, so then going back to the to that time post COVID, you were sitting there and you said, "Huh, I have this natural curiosity. My mind is
Yeah,
going. I'm thinking." After a particular length of time in the admin side of things, can you talk in more detail about how what your mindset was?
yeah,
How it went from, okay, here we are in this pandemic. Here we are in
yeah,
this, like, here's my experience with this, and then
yeah,
really, like, at
yeah,
what point was it? Yeah.
yeah, yeah. That's a great question. Like, and I would say it's not even after the pandemic. It was really at the heat of the moment, at the apex of the pandemic, where,
Uh,
uh, you know, just taking care of a really sick patient. I was putting a breathing tube into somebody who had like probably would have died if we had intervened within that moment. And I don't know if it was like my second or third intubation of that day. It was a really busy day. I remember it was on the weekend, and I was just like, man, I really hope I get paid for doing all this. And I
hmm.
had this huge, huge sense of guilt thinking, I'm like, why am I even thinking about this? I was like, well, like to be fair, after I stabilized the patient, I was like, well, like we're under a lot of financial duress and we're under a lot of pressure and specific insurance payers are not reimbursing us adequately. And I'm like, and our reserves are kind of dipping a little bit. Like, how do I plan for the future? And I'm like thinking about the monetary value for that experience. So, and I realized that the third parties, the services, the softwares, these offshore vendors in India and Pakistan were just doing such a, excuse my language, but doing such a crappy job of like, they just think it's just some like, little thing on their like Excel spreadsheet or like, on their platform, but they don't see the blood, sweat, and tears of what that number means, right? And why I am there on a Saturday night doing this critical procedure to save somebody's life, and that if I don't get paid, like, how does that make me feel?
Sure.
And so after just trying all these legacy solutions to solve medical billing, there was nothing that made sense. And I realized the people on the other side didn't really care. Their incentives and values didn't really align with what we were doing. And everything was just being dismissed, and I kind of went full throttle in some of that due diligence. And I realized, I was like, instead of trying to go through this rabbit hole of trying to find the best solution out there, I realized it didn't exist. And that was when I realized we need to create it. And obviously, that was during the surge of the usage of ChatGPT, and a lot of my AI scientists, AI engineers, a lot of my engineering friends were like, "Hey, here's what's happening. Like, yes, it's kind of cute that right now it's writing a bunch of funny poems and rhymes and generating some
Yeah.
email content, but here's the true power of what it can do down the line." And that is what opened up my imagination and mind to have this task specific, mission driven new way of tackling a very unsexy but the most important problem in our field.
Are you able to go into more detail with somebody that's not a doctor?
Yeah.
Even though I guess, I don't know.
Yeah.
I'm definitely not. But if you could you go into more detail about what you mean by this problem. Like I mean, you
Yeah.
mentioned,
Yeah.
not getting paid
Yeah.
adequately, reimbursed adequately, all these things.
Yeah.
Like very
Yeah.
functionally, what is it that's
Yeah.
occurring, and
Yeah.
very
Yeah.
functionally, what is it
Yeah.
that you're solving?
Yeah. Yeah. So let me give you an analogy first, Blake, so you can sentimentally
Let's
empathize
do it.
with you. Yeah. I don't know if this is the best example, but like, let's say, Blake, you know, you and I are we're chefs at a restaurant, right? And let's say a customer comes in, orders a burger, and then, you're the server for that day. You go service the customer, bring out the burger, and they're like, "Hey, I want some fries as well." Okay, we're gonna have some fries, condiments, whatever it is. It spent 30 minutes, and then the customer is like, "Hey, Blake, thank you for your service. Thank you, Bo, for cooking up that burger. I'm gonna go home now.
Delicious.
Delicious. I,
Delicious.
I don't know. Maybe not. It was okay. It's not too bad. I'm gonna go home now, and uh, I want you to mail me a receipt of the service you provided, the burger that you provided, that you cooked up, and the fries. And maybe in 30 to 40 days, if I feel like it, I'll take a look at your receipt and your invoice items. I will determine if that burger was really like well done, if you actually served me 19 fries, if you actually provided 30 minutes of service, of customer service to me at your restaurant. And then if I feel like that's appropriate, Blake and Bo, I'm going to pay you that $19.75 in about 45 days. But I can't give you information about that. And then maybe I'll mail you a check, and then you got to just deposit it.
Okay.
Now, imagine if a customer walked into a restaurant and had that response. You and I would look at each other and be like, you must be crazy, right?
Yeah.
That is how healthcare and physician services and hospital services are delivered. So I take care of you, Blake. And so you come into the hospital, you got stomach pains, and I touch your belly, do an ultrasound, get some lab work, and I figure out you have gallstones and they're infected. Okay? You get your surgery taken out, you stay in the hospital a day, and you leave the hospital. Then I gotta document all of this, and then I need to come up with some codes that quantify the service and diagnosis of what I provided,
Hmm.
submit it to, let's say, United Healthcare, and then maybe 30, 40, 45 days, United Healthcare is like, yeah, you know what, Dr. Gu, you didn't really document how long you spent with Blake, like what was the ultrasound here? you know, there's some stuff, and maybe they won't even word it that way. They'll keep it a very vague denial code and just say, you know what, Dr. Gu, we can't pay you that $285 for taking care of Mr. Blake here. We're gonna reject it, and then you need to go on our portal and find out. Then the biller needs to go back to my documentation, maybe upload the documentation, upload the operative note, make sure the coding that I quantify the service I provided matches up appropriately, and then resubmit that. And so for a minimum of 30 days, if not double that, I see nothing for the service I provided a while back. And sometimes, even if it meets medical necessity, meaning that I documented accurately, I provide the service as suggested. Sometimes there are some arbitrary process where the commercial payer will still say, no, we're not going to pay you.
Hmm.
So this is that delayed, fragmented, opaque process known as medical billing. And this is just a brief overview of a much more complex ecosystem that physicians are never educated but have to tackle just to get the monetary value of the service that they provided.
Thank you. Thank you for that. And so then your solution steps in, and what part of that process
Yeah.
does it address?
Yeah. So great question. So I would say the frustrations and pain that physician practices, hospitals, organizations experience, especially on the smaller side, is that entire cycle and ecosystem from the second I'm done with my notes, creating the claim, submitting it to something called clearinghouses, submitting it to insurance portals, uh, representing a United Healthcare, Anthem, Blue Cross Blue Shield, and then figuring out if you got denied or if you got paid or if you got underpaid, and then
Hmm.
figuring out the whole process and then making sure all the numbers reconcile and do payment posting, which is kind of some type of like similar to an accounting practice. We tackle the entire cycle and process with AI agents, with human in the loop and human oversight. So meaning that when if I'm a physician out there in my own clinic, other than just clinical staff, this entire medical billing process is given to us, and we take responsibility to make sure that money falls back in your pocket.
The way you're painting this is extremely convincing. and,
to
and to me, like with
to a
no prior
non-physician,
context.
even yeah, to even a
Exactly. I'm
non-physician,
I'm like
yeah,
I'm like, yo, can you get this to me? Like, can I use it?
yeah,
But so and that's what I mean is that and that's what's really cool about, speaking to you. I mean, a founder that's personally experienced such an intense, crazy problem, and the ambition to try and solve it. So in theory, like it does really, I'm like, wow, this is crazy. Like we should do it. In practice, what has it been like to take this out of this, like, really nice, like energizing story that you just told, and like, make it a real tangible thing?
yeah. I mean, from the customer experience, let me just say, I know you're probably talking about my own personal experience in this, but from the customer
Both.
experience, this is a terrible experience. It's fragmented. You're dealing with multiple third parties. You're dealing with clunky software that doesn't show you data. You're working with people, like I said, are being paid close to a minimum wage or a little bit
Yeah.
higher, and they're not aligned incentively financially with trying to get the bigger cash value items back for you. And so it takes a team of in-house people, third-party billers, clunky legacy enterprise solutions to tackle this. And for my own personal journey, it was a lot of digging and trying out a lot of other solutions, offshore solutions, and getting a lot of demos with other organizations to be like, okay, here's what I like, here's what I didn't like, and speaking to more physician owners and other hospital leaders to be like, hey, what do you really care about? This is what I cared about as a KPI.
Yeah.
What do you care about the KPIs? And
Yeah.
once we had that consensus of what those KPIs look like and what that user experience would look like, we built it.
So then how about, also from the idea, from those conversations, from gathering all the data to the first day where you were like, we are going to build it, and you assembled a team, to whatever capacity you did, however you funded it, like how has the process been from when you started it to where it is now? How has it
Yeah,
changed? How has it been
yeah,
different? What's
yeah,
your personal experience been?
yeah, yeah. That's a great question. That's like trying to think of how to tell this story in a concise way. Is that it's been a journey. It's really been a journey, and obviously, uh, humbly, I would say, working 7 days a week. Uh, you dream about it. You wake up to it. You wake up to customer calls. You sleep thinking about numbers like revolving in your head. Um, it it has been it's been a combination of an epiphany, a frustration, just every mixed emotion that you've experienced in life, cramped and crammed into like a little over a year now. But it really comes, what keeps you afloat is really kind of getting the feedback from physicians. And for example, there was one physician who's like, I don't know if my group, my physicians and I are going to be able to continue this practice. And we feel like we're being strangled by our current uh, vendor. And like verbatim, strangled, the word strangled. Like you don't hear about, like, you don't go to like, you don't, rarely do you hear a customer say, I'm being strangled. I'm going to die. And to hear a service provider strangling their customer makes no sense. And it made me so emotional when I heard that. Um, and I was like, this guy is like an orthopedic surgeon who is just trying to make a living, and he's now dipping into his cash savings for his house to say, like, I need to make a living, which is scary. A physician should make enough money where they shouldn't have to worry about
Yeah.
dipping into their cash, right? They're not like a lowly skilled, laborer, right? And not to be condescending towards any other line of work, but like you should make enough where you have a little bit of comfortable margin at a minimum.
Yeah.
So that keeps me going. We've been very, because we've been working so hard and because we keep on getting that iteration and constant customer feedback, our product maturity here is better and can do more things than legacy companies out there that have been working on this for like 20, 30 years.
Oh
And
wow.
we are now hitting that kind of demand of like, hey, like I heard about you and I really want to know what this can do for me. Um, and I think it's always nice to kind of get that inflection point a little bit of that organic word of mouth, um, beyond just pure kind of advertising marketing.
Yeah, well, I mean that's another question that I had was as far as growth goes. At this stage of the
Yeah,
company, like how are you approaching that? Is it outbound? Is
yeah,
it mostly inbound word of mouth, like you're saying?
yeah,
Are most of your
yeah,
resources involved with product development? Like what's the
yeah,
mix of all of those things?
yeah, yeah. Um, yeah, I would say most of it has been, pretty organic, although we understand to really bring awareness to the problem. A lot of it actually, is actually educating the customer as well. It's not just, sometimes physicians like, I don't really know anything about billing, but I just know that my paycheck got cut in half and it doesn't make sense, but teach me about billing because I need to understand and I need to like adopt your solution. Um, so it's really been about promoting that brand awareness where we are doing more of a systematic approach and making sure people hear about us, from events, from a little bit more digital advertising. And as a physician, you're nearly not taught any of this, of like how to you know bring that brand awareness to the greater public. And sometimes you have that like, oh man, I feel a little fake, the fact that I have to use Facebook ads or Google ads. You're like, but if you don't put it out there, then all these other inferior and really strangling solutions are going to outcompete you. And that's not how you service and serve, the greater clientele. So we are transitioning more from that organic to kind of systematic approach and kind of that omnipresent, channel feel, for everybody, because a lot of times like, hey, I think I saw you on this, or maybe even I saw you
Yeah.
on this podcast, right? That's how people are made aware of who we are, and then our product and our value speaks for itself.
But what is the greatest hurdle that you feel like you're facing at the moment, and how is it also
Yeah,
an opportunity?
yeah, and I think I highlighted one of that, which is just awareness, making sure people know about you, and realizing that like medical billing is this unsexy problem, but once you kind of uncover the hood, you're like, wow, this is Pandora's box. And then when physicians realize how big of a problem it is, uh, they're like, I need to quickly let my peers know. And I'm like, how do I scale this? How do I scale this? And a lot of it is just going on podcasts. A lot of it is writing things. A lot of it is speaking to um, a bigger audience. So that is my biggest hurdle right now. It's still early in the game, but I feel like this problem can't wait. Physicians can't wait. And if we continue this, and I'm not sure if you know this, but in a few years, we're about to face 86,000 shortage in physicians as a supply problem. 86,000, and that's going to affect tens, maybe hundreds of millions of patients. And people are like, yeah, it's okay. People are going to always want to replace that, but it's not that simple.
Well, is that related to the rate of retirement and the rate of enrollment?
Yes, that does play a little bit, but it has to. This is kind of where a lot of people talk about like the burnout, the physician burnout. Um, and honestly, it's very simple. Physicians just want to feel valued and appreciated, both a little bit from a sentimental value, but also more importantly from a financial value, right? Just like, yeah, like I'm saving lives. Can you just pay
Mm,
me for what I'm doing? It's something as simple
mm.
as that. But it's wrapped in this package called medical billing.
Well, Bo, there's you spoke a lot to it, and just for the sake of the question, just to hear it again, because I really love it. Is what inspires you?
Yeah, it's a great question. I would say that it really does come down to the customers. Um, it's kind of weird actually. Still, every time I have to be like, when I say customer, it's really weird. Be like, they're your physicians, like they're your peers, right? They're your, and sometimes hospital administrators. And one of them actually got really teary-eyed asking for help.
Hmm.
And technically we should only shed a tear if a patient passed away. But like, imagine shedding tears because of a financial problem. That motivates me. That is very inspiring and kind of like putting the 14, 15-hour days, 7 days a week. And like, that is what kind of keeps the fire lit in your belly. And I know that if we don't lead the solution from a physician-led voice, and have outside people come into our field, creating solutions that people don't really want, it's only going to make the problem worse. And that is also what secondarily motivates me to make sure that this is built from and by physicians for physicians.
Let's go. I love it,
I'm
man. Thank you so much.
Thank,
Thank you,
yeah,
Bo. These
yeah, no, thank you.
no,
Thank you
no,
for
you're
having
well, yeah, man. Your input is really cool. Your story is really awesome. Your solution is cool. It takes so much ambition, dedication, belief, determination, perseverance, all of these words to do what you're doing. And it's really important that you are. So thank you for doing that. If anyone else was inspired to follow your story, what's the best way to do that?
Yeah, you can visit www.youlify.com or add me on LinkedIn. My name's only 4 letters, so it's pretty easy to find. But, I would say, it's been humbling. This whole journey has been humbling. And, I think if you didn't swallow your ego and see the bigger pain point, I've learned a lot about myself and humility throughout this process. And I'm sure this is only going to go deeper in time. So,
Awesome. We'll
all
keep
right.
it going. I'm excited to keep in touch.
Yeah. Thank you. Likewise, Blake. Thank you so much.
You got it. Bye bye.